Recognizing and diagnosing ailments remotely through AI would, in my opinion, lead to more accessibility to healthcare and would lead to a more evolved and brighter future.
The future of medicine in India should be focused on improving access and promoting equity through technology.
Implementation of continuous human oversight should be expected. New generation dentists should be acquainted with AI technologies.
With advances in gene editing, technology to overcome paralysis, single cell analysis, effective treatment for spinal cord injuries, mapped circuits for vision, memory, and emotion, the future of medicine is bright.
The computational algorithms already available in imaging have helped doctors diagnose lung cancers and breast cancers much before a patient gets the symptoms or can present to the doctor. Imaging has shown that the tumors can be picked up at least 5 years before they become symptomatic, hence increasing the rate of cure in these patients.
So in toto, it's going to be an era of techno-medicine, wherein the phrase what we used to hear as think globally and act locally might become think globally and act globally if the regulatory framework becomes more conducive.
Also, the molecular biology and the cancer genetics have helped the researchers target the cancer specifically, especially for lung cancer and pancreatic cancer, thereby proving a boon for so many patients.
Be inspired. The future of medicine, tech, AI and molecular research. Ashish Tripathi, Toby Walsh, Jahnavi Phalkey and Sethi in conversation. In many ways, the future of diagnostics lies in technology, machine learning, molecular biology and cutting-edge R&D. According to the Future Healthcare Journal, AI will be increasingly applied within healthcare, especially for the tasks of diagnosis and treatment recommendations, patient engagement and adherence, and administrative activities of the healthcare workforce. What does this mean for the treatment and prediction of future pandemics and for the gamut of research across medicine? Our diverse panel of experts seeks answers for you. Ashish Tripathi is the founder and CEO of Zar Labs and director of Epigeneres Biotech, spearheading the global launch of all major breakthroughs in molecular diagnostics achieved by the company. Ashish has more than 20 years of experience in investment banking and corporate finance, M&A and financial planning experience across the globe. Toby Walsh is a Laureate Fellow and Scientia Professor of AI at the University of New South Wales and Data 61 and Adjunct Professor at QUT. He was named by an Australian newspaper as one of the rock stars of Australia's digital revolution. Professor Walsh is a strong advocate for limits to ensure AI is used to improve our lives. He has been a leading voice in the discussion about autonomous weapons, aka killer robots. He has authored 2062, The World That AI Made. Jahnavi Phalkey was appointed founding director of Science Gallery, Bengaluru in November 2018. Previously, Jahnavi held a tenured faculty position at King's College, London. Ms. Phalkey was also external curator to the Science Museum, London, and has been a scholar in residence at the Deutsche Museum, Munich. She is the author of Atomic State, Big Science in 20th Century India. Dr. Sethi is a physician-scientist and associate professor of computational biology. Dr. Sethi specializes in improving outcomes in neonatal, child and maternal health by bridging medicine and artificial intelligence. His research is focused on development and deployment of machine learning-based solutions to enable decisions and policy in pressing healthcare questions such as antimicrobial resistance, sepsis, and health inequalities in intensive care and public health. As you listen to our speakers, do remember we have an ongoing audience poll. Click on the poll button on your screen, answer the questions, and let's find out what you think about the views being aired on the show.
will have a bigger impact than fire. Sundar Pichai said that just a day ago. Artificial intelligence will have a more profound impact on humanity than fire, electricity, and the internet, the head of Google has declared. This and many such pronunciations populate the public discourse on artificial intelligence, and we often do not know what to make of all these pronunciations. Some of us are worried about jobs being taken over. Some of us are worried about biases, historical biases being repeated by machines learning the same things or the same mistakes that we've been making in the past. Allow me to ask you, following up on Sundar Pichai's fabulous hook for us this morning, what can AI not do?
What AI can, well, AI is about actually analyzing the data and, doing machine learning so that you can actually understand the trends. There's a very famous study that was recently done, I believe in Australia, where they were taking random inputs, and they had actually found that the language that was being used by AI became very, very crass because they were trying to reach out to the broader audience to get their feedbacks to certain standard questions. So what you need to understand with the AI concept is that it's actually analyzing data and actually trying to make sense of that data. If the input is garbage, then frankly the output can also be garbage, right? And that is one of the issues that you need to be aware of, and the computer has to be trained. Right, but that said, it can actually it's very fascinating the kind of patterns that it can actually predict even about behavior. When it comes to the specific area that we are looking at, when I'm actually talking about healthcare, what the reason we consider AI to be an excellent tool for us is because we are actually collecting a lot of data that hitherto had not been collected. And in trying to actually make sense of that data and get intelligence from that data, we think that AI is an excellent tool.
I think if you had asked this question 10 years back, we might have thought that AI may not be able to imagine worlds. However, I mean, the fascinating advances in AI now allow that also to be done in some sense, where machines are now imagining world scenarios and then basically picking up the best ones that can advance. However, I do believe that in fields like healthcare, where our basic understanding of health, for example, is contingent upon expert knowledge, which itself evolves over time. So which trials to conduct, what are the randomization experiments that we should be doing, and what are the cofactors, what are the confounding factors. All of these things require some background understanding of medicine and knowledge that is deeply rooted in medicine. So I do believe that although we are moving towards AI systems that can conjure up scenarios and then devise some of these experimentations, in the real world, as of now, our clinical, medical, healthcare understanding is far from being perfect. And that is where I think there is a challenge for AI to continually match up to the state of the knowledge in medical systems. In some cases, it is even able to advance our state of knowledge. But in most cases, we believe that we are limited by the data, we are limited by our background understanding and whatever variables we can feed and collect for the system to be able to train.
So in a way, what you're saying is that machines don't understand uncertainty, or they will grasp only as much as we, so in a sense, they take for granted what we teach. Toby, would you agree? Would you disagree? Would you have some new things to say?
Well, I would agree somewhat with the CEO of Google that it is going to be remarkably transformational. If you think about it, everything that you see around you is the product of our intelligence. And all of our medicine is the product of our intelligence. And I do believe that we will ultimately build machines that will match and probably exceed human intelligence. I think it would be terribly conceited to say that we were as smart as you possibly could be. There's nothing in science that would suggest that human intelligence is some fundamental limit. We will be able to build machines that do those tasks perhaps at a superior performance than humans. So that, I think, is going to be very profound. And that's going to transform every aspect of our lives. And in particular, it's going to transform how we conduct medicine. And we will hopefully live healthier, longer, happier lives. But that hasn't answered your question. That hasn't answered the question as to what machines won't do. That's actually just said what they will do. And what they won't do is very obvious. They lack our humanity. They are ultimately just machines. And so they're never going to have our emotional intelligence, our social intelligence. Even if we try and make them fake it, they don't have emotions. They don't have feelings like we have feelings. And so they're uniquely disadvantaged in trying to understand us. So I see a future which is going to be full of just as many doctors. Maybe the doctors are calling upon machine specialists to help them to bring in the vast amounts of knowledge that have been encapsulated into their programs. But at the end of the day, I want, and I'm sure most of our listeners want, a human doctor to tell us the good news or the bad news that we've now become a father or a mother, or that unfortunately we've got some inoperable cancer and this is our prognosis. So I see a very wonderful future where the machines will hopefully be raging with us and helping us all to live better, longer, healthier, happier lives. And if machines do take over some of the sweat, well, that's, I think, something to celebrate.
Many ways, Toby, listening to you reminded me of the enthusiasm that women had in the 60s and 70s with different kinds of labor-saving devices coming in. I'm not saying it's exactly similar, but what I'm saying is that in taking away drudgery at that point of time, it made possible the entry of women into the public domain in the workforce in ways in which it simply wasn't possible before because of the amount of work that simply had to be done, which no one else could do. And with machines doing that work, a different life, a different future became possible. So thank you for that.
Can I just pick up on one point? I think that's yes, such please. A wonderful summary. But also, what follows on from that is that we then get to decide what that time is that we've got freed up, in what way it's going to be used. And so it stops being a technological question. It becomes a societal question. Okay, well, how then do we ensure that women are best represented in the workforce and that that's used as a force for good?
Absolutely. So when we were training in history of technology, Melvin Kranzberg, who was one of the founders of the field, had 6 laws of technology. And the one that stayed with me always is where he said, technology is neither good nor bad nor neutral. And I think that's something, if we kind of work with that and if we grasp that strongly in our day-to-day life, we stand to probably benefit and create an AI sphere, so to speak, or an AI world that complements and helps build upon human ability. Would you tell us how is AI transforming medicine?
So, there's been a fair bit of press on us in the last 1.5 months because we got published in Springer Nature journal. Effectively, what we have achieved is a technology by which we have achieved 3 global firsts. We can detect cancers and all cancers earlier than any known technology, straight from a blood test. So we can detect it prior to tumor formation. And at this stage, we can tell you which cancer and where it is forming straight from a blood test. The second thing is that this is the first prognostic test for cancer. So not only does it tell you that you don't have cancer, we can in fact rule out the risk of cancer for you for the next 1 year. But the key breakthrough that actually makes this technologically possible is that we have made a breakthrough by which we can actually get your transcriptomic or RNA readings from different organs in your body straight from a blood test. If you were to step ahead, the reality is that the scope of that technology then does not only restrict itself to cancer, right? We will perhaps be able to early detect a whole series of other diseases as well. Right. And now, if you actually look at the concept, the reality is that your molecular markers or your genetic markers show the mutations first. Then you get cellular markers and then you get symptoms. Right. So what we are effectively doing is that we are able to actually detect diseases far earlier than known technologies. Right. I can actually detect your dynamic markers as to which organ is at risk today. Right. Which mutations have you actually got? what medicines could potentially cure them, and so on and so forth. All that is made possible by machine learning or AI, right? Because as a manual process, it just becomes too hard, right? But this is the future that we can actually see.
Thank you very much, Ashish. Tapritesh, you are a physician scientist. Can you help us understand in what ways is AI transforming medicine today?
Yeah, sure. So I can begin with the high level changes that are happening. So you can think about AI in healthcare at 3 different levels. One is making medicine more efficient by taking away the drudgery. We are devising more efficient systems by automation, some of the tasks that doctors have to perform. The second is where AI can help in devising alerting systems where we have early detection of diseases which might be acute or chronic, example being what Ashish talked about, early detection of cancer. Or, for example, work from our lab in early detection of critical outcomes in the intensive care units, or early detection of outbreaks in the public health settings. The third thing that AI can do, what Toby referred to, is actually to revolutionize the knowledge by surprising us and by creating new understandings about how human physiology works, or how health is wired, or how health systems work.
Toby, from your work, what are the areas you see where we're going to see medicine transformed?
I think it's worth remembering it's not going to be magic. It is, but it will let us do things that we couldn't do in the past, even if it's not magic, because it may let us do things at a speed or a scale or an accuracy that's beyond human. And so I've got a couple of examples of that go back to the beginning of life. And I think the important thing to realize is that medicine is still practiced much the way it was 100 years ago. And so there is a great potential, just as in many other areas where AI is being used, to use AI to personalize what the medicine is and how it's delivered. And so let me just give you 2 examples already out there of how it's going to transform the very nature of life. So the first one is a fantastic Australian company called Life Whisperer, and they're helping people go through IVF, in vitro fertilization. Now, the most critical thing you do when you're trying to do IVF is work out which of the fertilized eggs to implant to have the greatest possibility of success. And you have more than one fertilized egg to look through. And so they've devised a computer program that looks down a microscope for a day or more at a time and observes the dividing cells and works out which looks like the most promising. Now, that's a wonderful example because human eyes were never evolved to do that task. So that's a life-changing decision. So that was the first example. And the second example, I'm going to go forwards to the moment of birth. We can take a blood sample of you at the moment of birth. Now, I mean, the other revolution that's happening that's, again, at a very appropriate time is the genetic revolution, the fact that we can now read at very low cost people's genotypes, and now we can increasingly start to write those genotypes with things like CRISPR. So we could look at genetic modifications, but we can really start to understand the code book of life. And that's something that human brain couldn't manage to do. So now they can predict a few things, like they can predict at birth how tall you're going to be. They predict the color of your hair, the color of your eyes. Well, that doesn't sound too important, but they can predict really important other things. They can predict your susceptibility to bowel cancer. Now, bowel cancer is a hidden death, a silent death. It kills many people, largely because it's not recognized in time, not because it's not preventable, but because by the nature of where it is, you don't identify it until it's too late. That bowel cancer would be identified at an early stage. We can identify the markers that would be appropriate for that. So those are life-changing ideas, and we're going to see many other examples as medicine becomes, I think, more and more personalized to who you are and what the diseases that you're going to succumb. So that, as I said, hopefully we live longer, healthier, happier lives.
Thank you for that. Which one of your projects is one that you'd like to discuss with us today in order for us to understand your own work in the field?
This is the government body in Australia that's charged with the responsibility of transplanting organs, kidneys, hearts, lungs, and so on. We have a real challenge in Australia, at least, and actually as in many Western countries, which is that there is far more people waiting for organs than organs that are donated. And so what we're looking at is, can we come up with a more efficient, more fair way of allocating those organs to patients? And so our hope is that by handing the task over to an impartial computer, we can actually end up with a system that is fairer and more efficient.
So Pritesh, may I ask you next, could you share with us a project of yours in the field that would be interesting to our listeners?
Sure, Jahnavi. I would not share one, but quick 3 projects that basically would distill what we are doing. So the first is to predict the emerging strains of COVID-19 using AI. And that's by using natural language models and the kind of models that understand text and predict what next word is coming up. And we read the genome as a book. Essentially, we have words in the genome because we have 3 base pair codons which code for amino acids, and COVID has been changing very fast. So we were able to look at these sequences, about 300,000 of these across the globe from 16 different countries, and we were able to find out patterns that actually were predictive of the cases, rise in cases, up to 1 month ahead of time. The other project is in the ICU space, which we've been doing for the last 7 years or so with All India Institute of Medical Sciences, New Delhi. We're in the Department of Pediatrics. We are learning to predict critical outcomes for babies and children ahead of time. And in doing that, we actually also solved partly a challenge which is broadly AI faces a lot, is a challenge of generalizability, that if we learn something in one setting, can it be really applied in many other settings? Third and the last is the way to learn models that are more explainable and can guide interventions in public health on ground. In India, we applied similar methods to learn to mitigate HIV transmission in sex workers. And using explainable models. And very surprisingly, we found some interesting factors such as financial literacy training, which we did not expect, but then actually was the most important factor. And our on-ground partners said that women who are more financially empowered are also more empowered to say no to unprotected sex. So the explainable side of AI is something that we care a lot about. And so these 3 projects I'd like to highlight in my works.
There's one of the key project that we are very emotional about is that we do want to make sure that we launch this early detection test in India before the end of this year. And the reason this is important for us is, as you know, that if you can detect this disease early, it's half the war won. Right. The project that I'm very passionate about, we're doing something with ACTRAC, where we believe we've got a specific molecule that can either slow down the progression of the disease or retard the growth of this disease for some types of cancer, as long as you catch it prior to tumor formation. What we believe is that our work will impact so many lives. It's already become the largest killer in the Western world. There are 800,000 people dying in India alone every year because of this disease. So if we are able to turn this into an early detection disease and able to try and delay the onset of the disease through the breakthrough that we are making on the molecular medicine side, we believe that this will help a lot of people.
What, in your eyes, is the biggest ethical challenge that AI in medicine needs to tackle?
There's tremendous power in the kind of information that we are capturing, right? And the reality is that while there's tremendous benefits that you can achieve, there's potential for the technologies to be used not for good purposes as well. And I think there's tremendous power in AI, but the reality is there's no doubting the fact that there's tremendous potential if these technologies are used for the good.
Thank you, Ashish. Toby, what would you say is the biggest ethical dilemma that AI in medicine needs to tackle?
Well, I'd agree. I think the biggest question is, should we do things that just because we can do them doesn't mean we should? And we've spent the last couple of 100 years developing a very rich set of ethical principles around beneficence, non-maleficence, justice, and autonomy that have been used to inform the debate around other medical technologies in the past. And those are perfect ethical principles to put the discussion around artificial intelligence in medicine. So I don't think we need to invent any new ethics, but we do have to worry about some problems like fairness that do get amplified possibly by these technologies. But we've always had to worry about the fairness, always, whether it be about humans in their biased way or about the data that we were using. And it's just that if we're careless in how we apply AI, those questions just become that much more pressing and more important.
So if I can just say one thing, to Toby's example, it's such a beautiful example that he gave on for IVF, right? But the reality is that, from a technological perspective, what if it moves towards, designer babies? Is that ethical or is that not? These are the questions that you need to think about. But the fact is that if a parent can get a child, now that's and they've been trying for a long time. If a technology can help there, isn't that something that we should be adopting? So there is an ethical dilemma, right?
And what this reminds me of is Asimov's suggested laws of, for robots and behavior in robots. A robot may not injure a human being. A robot must obey the orders given it by human beings. And a robot must protect its own existence as long as its protection does not conflict with the first or second laws. Would you agree with that?
I think having laws, just as you talked about the robot laws, doctors typically take the hypocrite. So the challenge, however, which is more difficult to solve, is the transparency of AI/ML systems, because all these laws are contingent to the current state of knowledge of the practitioner, medical practitioner, or the robot. So now, if we are delegating some of that decision making, or augmenting our decisions via machines, we are relying upon a black box, and that brings in distrust. So I believe that the ethics that clinicians will follow going forward while engaging with machines will need a lot more transparency of machine intelligence, so that clinicians can actually adopt it. And then ethics may become not so much of a problem going forward.
I would like to disagree there. I think transparency, where it's possible, is of course often desirable. But there are many settings where transparency is not possible or not even desirable. And I point to my own doctor. She is not particularly transparent in her decision making. She's got decades of experience that she tries to distill down. But I put my life in her hands because I know there are institutions, the systems in place, but she's a good doctor. And so that I can go into the room without having to be an expert that she is in all the different fields of medicine. And the same will be true. I often wonder, I could perhaps build an AI system that is a better system at diagnosing, a particular type of cancer. And maybe it's going to be more accurate if it's not transparent. Now, what choice would I have? Do I go for a more transparent, less accurate system? Or do I trust my life in a system that's more accurate, but less transparent? I know what I'm going to choose. I'm going to choose the less transparent, more accurate system because I'm going to live longer that way.
I partly agree. I think, So it's medicine is a field where the decision rests on the clinician. So I think the transparency to the patient may not be necessary, but if the clinicians are comfortable making that choice with the state of the AI systems, they have to sign off on the patient's decision making. So I do partly agree.
Okay.
I think we're putting our finger exactly on the issue here, which is how do we design the institutions so that we can put these systems in there, so that, like the bridge behind me, we can put our lives entrust our lives with them. And that's still to be done. We don't have those institutions. We have that for doctors, human doctors, but we have yet to develop that properly, appropriately for our AI assistants.
where do you see are the unexpected areas of growth for AI in medicine, and where is the room for correction? Pritesh, could you start?
So I think that one of the unexpected areas where AI could make a huge leap is in the molecular side of medicine, because we know so little of it right now, and the way our systems are complexly wired, and it's a very dynamic state. I mean, every minute, every second, our organs are cross-talking with each other through all of these molecules, and all of those data are not collected, sometimes even cannot be collected at the kind of the resolution that we would desire. Just as AI systems learn to play Mario games or fold proteins, can we really evolve physiology or even, for example, the prenatal development? So I think all of that will be is imminent and is likely given the rate of growth of AI. But yeah, I think that's where it'll be an unimaginable kind of a scenario of growth and new knowledge.
Thank you. Ashish, would you like to share with us your thoughts?
If I could just extend on Pritesh's thought, because I do believe that there's a huge scope for molecular medicines, but if I can extend that into personalized medicine, you know, if you step back, the way the medical fraternity has worked is that, you know, you land up doing, when you discover a particular molecule, you go through phase 1, phase 2, phase 3 trials, etc., and you're effectively trying to actually show that the molecule was effective on a larger percentage of people with that particular ailment, right? What is not understood is that there will always be a small number of people on whom that particular medicine did not work. And what I believe that, you know, where molecular diagnostics and molecular medicine is heading towards is actually looking at what will be the personalized treatment, and how do we measure it, right? So that we can actually serve that patient better.
There's a lovely quote. Sorry, there's a lovely quote by Val Harrion, who's the chief economist at Google, who says that if you want to predict the future, look at what rich people have today. And that's what the rest of us will be able to afford through technologies in the future. Well, what do rich people have today? Well, they have personal physicians. And so my prediction is that we'll end up with all of us with our own personal physician. Well, now, especially with low-cost sensors, you're going to be going to the doctor, your personal AI assistant doctor, every day, perhaps every minute of every hour of every day. We have an opportunity there to really transform how we live. And it's going to be the traditional elements, but also I think we're going to see huge great advances in things like our mental health, that we'll be able to use these tools to help actually improve our mental well-being, something that I know in the last 18 months has been severely tested by the pandemic.
Absolutely. And it would be a fabulous thing to see in the future, machines complementing the kind of care, and a word that Toby you use, which is well-being, which goes beyond health. One where it is possible to have a better life, as you said.
An idea can change the world. All we need is passion, focus, and a desire to help. If you have an idea rooted in artificial intelligence, machine learning, or molecular medicine that can transform healthcare, please send us your idea at whatever stage it is in. Our panel of experts will assess it and help propel it towards reality. The sky is your limit. Don't wait. Mail us your idea or innovative thought at beinspired@teamworkarts.com.